So my name is Dr. Mohiba Tareen. I'm a board certified dermatologist and dermatologic surgeon. I practice in Minnesota, and my office has 4 locations throughout the mid and southern Minnesota area. My passions are all aspects of dermatology, from skin cancer to rashes to acne. Our office really tries to take care of the whole patient and the whole family. This is a great question because there are so few people of color dermatologists. So I think number one, we need to encourage providers of color to enter all facets of medicine, to recognize the things that are particularly integral to our group. I was reading, there was some really interesting Star Trib article the other day about how Black doctors are like 3% and Black nurses are like 8% in Minnesota. It's like so sad, Asma. But anyway, that's one push. We need providers of different colors and backgrounds and genders to help with our niches of patients. One thing that I'm very proud that we provide at Tareen Dermatology is something called telehealth. Telehealth are, virtual appointments. And just as we were saying, atopic derm has these periods of ebbs and flows. And I've really found this is a good part of the pandemic, that people, when they're going through a flare of atopic derm, they just need some guidance. And especially if it's their child, they need to be almost given the privilege to say, hey, you use that super potent topical steroid. You're okay to use it now. You're not harming your child. In fact, that's going to help your child. So I think telehealth is really important for atopic dermatitis flares. Number two, I think we as doctors overestimate our patients' health literacy. We may just say something quickly and think that our patients get it, but what have the studies shown? That it takes 3 times to hear, and then the patient only is going to get like 1/10 of what they got out of the medical appointment when they leave. So I think number two, I'm really passionate about providing written handouts, particularly for my atopic flares, because I write out an action plan. It's called an eczema action plan. That's not just what I do. That's what dermatologists call it, eczema action plan. And we say, when your kid is really good, you do this. When your kid is really medium, you do this. When your kid is really bad, do this. So the patient knows what to do at different points of ebbs and flows in their skin. Number three, I also like to provide resources, even online on Google Images, of what patients should look for flares. So we know, again, that in people of color, typical signs of redness can be gone. So even patients may not recognize, like, oh, I'm getting a flare here. This is a cut that's getting bacteria in it. So I like to provide visual resources. Number four, we like to, at Tareen Dermatology, also educate primary care providers via webinars, social media, podcasts. So because so much of skin is going through primary care because it's hard to get in with a dermatologist. So it's really my responsibility as an expert in our field to educate others. Number five, this is something that I think you are doing, and I thank you for this. We are trying to teach and provide materials for people of color to know that they should have some resources. Like, we want textbooks for people of color. I'd love to make like a little children's book for kids with eczema that features brown skin kids, to say like, hey, it's okay when you get bumps. That's not your fault. When you scratch your bumps, I know it's really itchy, but you need to use this instead. So we'd like to get resources that make it okay to be brown skinned and suffer from skin disease when you're young. Number 5 or 6, wherever I really would like insurance. I'd like to have like a congressional discussion for that. CMS and insurance companies should provide longer appointment times for these very complex diseases that then can snowball and worsen, versus, just a quick 5-minute appointment that you've got to address all these skin and behavioral issues. The parents do everything they can, but if you don't have the tools to keep your kid better, then you're just going to go through so many flares. So that's number one. Kids suffer from atopic derm, and their medication formularies are terrible. Number two, the density of pediatric dermatologists. So I'm a dermatologist, but there are people who do subspecialized training in pediatric derm, and to take care of the very severe atopics who need systemic therapies that have a lot of side effects. We're talking, you're putting your kids on an immunosuppressant that could stunt their growth, stunt their development, but your kid is so miserable that you're going to take that step. A lot of us as general dermatologists don't want to take that step. We want to refer to a super specialist. And these super specialist pediatric dermatologists are really very concentrated at academic institutions in urban areas, and people with really bad atopic derm can't get the bus to get there. They can't take public transportation to get there. I will go out of my way to like call my pediatric derm friend and say, you know, Jason is having a terrible flare and I think he needs to go on something called methotrexate or, you know, Dupixent or something. And my friend will say, hey, Mohiba, for you, I'll get your patient in. But then my poor patient can't get there. Like, it's like, I want to drive my poor patient there, but you're legally not supposed to do that. Okay, so what else? Also, there are some natural therapies for atopic derm that are really good in skin of color, particularly something called phototherapy, because it helps regulate the dyspigmentation that can occur. So in skin of color, as you had said, atopic derm, it's often recognized later because in white skin, we see that redness. In brown skin, black skin, sometimes it's just bumpy. Sometimes it just has like a little rough consistency, and providers are not recognizing that until it gets very purple, very cracked. So the recognition is later. Coming back to what I was saying, there's some natural therapy, something called light therapy, phototherapy, that's been around for about 100 years. That's great for brown skin and black skin because it helps regulate the whiteness and the darkness that can occur from these inflammatory processes. And phototherapy, again, is difficult for individuals to get to. People of darker skin, sometimes, we live in these urban areas where it's, it's not available because phototherapy is not very well covered by insurance. Number one, atopic dermatitis is more prevalent during childhood. According to the National Eczema Association from 2020 statistics, approximately 10 million children in the United States are living with atopic dermatitis, and the prevalence of the disease for age under 18 has increased from 8 to 12% in the last 25 years. So we know that many children have atopic derm, but also many children have medical assistance. So the Venn diagram of kids and Medicaid overlaps quite a bit. And the formulary, the medicines that are covered for atopic dermatitis on Medicaid are very little asthma. And they may be just super potent topical steroids that really only adults can use on their skin, because kids can get what's called atrophy, which is thinning of their skin. So these Medicaid formularies are not taking into account that children's skin is quite different than adult skin. So that's a big problem. Secondarily, atopic dermatitis goes through these periods of flares, then better, flare, better. And to prevent those flares, we like as dermatologists to use some maintenance type of therapies. We don't want to just treat the atopic derm only when it's flaring. We want to treat it also when it's better to prevent those flares. And the medications that are used to prevent so-called maintenance medications are called calcineurin inhibitors. They were developed more than 20 years ago. I've been a dermatologist almost 20 years, and they're off patent. They're generic medications, but they're still not covered by Medicaid. Atopic derm, like a disparity that I see as a practicing dermatologist. These appointments are so short, and people with very severe atopic dermatitis can get behavioral issues. They can get social anxiety. There was a good study, and I can send this to you, in the Journal of the American Academy of Dermatology, September 2022, predictors of depressive symptoms in atopic dermatitis. These people with atopy have much more depression. They have more severe depression. Their depression fluctuates with their flares. So we know that these people should be monitored. Like when they come see me, I need to be able to spend 20, 30 minutes with them. I need to talk to them not only about their skin, but what is going on psychologically. And medicine is very geared to procedural things. I'll make 10 times more money removing a skin cancer than talking to my patient about atopic derm and how he or she is feeling on the inside. So those are all these terrible disparities. One of the reasons I am drawn to taking care of atopic dermatitis, which is a type of eczema, is number one, personally, my son suffers from moderate to severe atopic dermatitis. So that gives me a passion as a specialist, but also as a mother. When he's itchy, when he's scratchy, when he's got bumps on his face, when people say to me, "Oh, what's going on with Kai?" Um, I, I, I know the science behind it, asthma, but I can imagine people who don't understand the science, they don't understand the itch scratch cycle, what that does to them. And I also see what that does to my child when he gets rashes, when he gets flares, it affects his self-esteem. It's already so hard growing up in America with social media and with just the abundance of people looking at you now from, in real life and different platforms. So I can see the stress that he goes through. So that's one of the reasons I'm passionate about atopic dermatitis. Furthermore, I trained at Columbia University, which is in New York City, in the patient population that is predominant in Upper Manhattan, are Hispanic, Dominicans, background of individuals. Many of them suffer from atopic dermatitis. So I learned to take care of these people of brown skin types, ethnic skin types, from the beginning of my career. And so I'm very passionate about others understanding how atopic dermatitis presents in people of color, which is very differently than Caucasian individuals, and the problems that we as people of color face with atopic dermatitis.